My name is Dr. Erik Nelson. I'm a naturopathic medical doctor who was born and raised in Calgary, Alberta, and just moved back here to serve some patients. I have one on the way. Actually, my wife is 8 months pregnant, so I'm about 1 month away from being a parent, which is terrifying, but also exciting. I do. We adopted a pit bull mix named Rocco about 6 months ago. Actually, 9 months ago now. So he's a pandemic child of ours. Of course, yeah. As a human, I feel like a lot of people that go into medicine typically have some sort of a health issue that they may have been trying to deal with themselves, and kind of led to their interest in medicine or their interest in a specific field of medicine. And I would say for me, it was just constantly getting injured. I grew up playing volleyball. I grew up swimming, playing water polo, volleyball, a whole bunch of different weird sports, diving for a little bit. And of course, that came with a whole host of injuries. And I think it wasn't until I went to University of Western Ontario that I visited a physiotherapist there. And they told me that I was basically a mess. They told me that I hadn't been able to turn on my glutes ever in my life. I didn't know what I was doing with the muscles that support my knees. And my feet had completely flattened and I had zero arches. So believe it or not, just a little bit of PT and a lot of work in the gym cured a big chunk of my pain, my relatively overuse syndrome. Most of those concerns that I had at that point weren't acute anymore. They were old injuries, probably stuff that I deal with now. So it's funny how 10 years later, you look back and you think of how that moved you towards the type of medicine that I'm doing today. I definitely didn't think about it at the time, but just seeing that there was alternatives to just doing a steroid injection or just resting and icing it, putting a little bit of the power into my hand was all it took. Because I ran with that. As soon as I was told, this is what's going on, these are some of the imbalances, and here's how you work with it, I just built off that, and I kept getting stronger and more stable, and I would get injured less, and I started actually being more and more and more active in the things that I loved to do growing up, but injuries would force me out of. So I'm thinking of like running, for example. Running is one of my favorite stress relieving activities, but I would very commonly get knee pain and different forms of jumper's knee and runner's knee flare up. And it would take me out of running, and then I would lose one of my favorite activities, one of my best stress relieving tools. And yeah, so it's just giving a little bit of the empowerment and a little bit of the education, and I just kind of ran with it, and I haven't stopped. I went to Southwest College of Naturopathic Medicine, which is a medical school down in Tempe, Arizona. Short and simple, because my wife was there. My wife decided to go there, and she's very convincing. So I followed her down there. But to be honest, it was the most inviting environment. So when we went down on an interview, and I got to tour the school, we got to sit in on a clinical shift, on a class. And it was very, very welcoming. I really liked the vibe that I was getting there. I recognized that it was very science-based, yet practical. Then the other aspect of it was we like adventure, right? So moving down to Tempe, Arizona was a new adventure for us, going down into the desert and living in the United States. So different country, completely different climate, making new friends, new activities. I think that was a big draw as well. Yeah, I graduated with a bachelor's in science in honors track and kinesiology from the University of Western Ontario, which I think is now just called Western University, out in London, Ontario. So I graduated in 2013. I was actually on track to become a allopathic medical doctor and a functional medicine practitioner. The idea behind it was that I was going to piecemeal my own education. So I knew that I knew I wanted to go into medicine. I knew I wanted to help and serve people. And a big part of the draw was the educational component. I really like to empower patients, and I really like to connect with people and teach what I know, right? And the allopathic medical schools really lacked in nutrition, and they really lacked in physical medicine in terms of using exercise as therapy. And with my background in kinesiology, I really, really understood the power of movement patterns, of exercise as medicine, as nutrition as medicine. And so I knew that I was going to have to piecemeal my own education. And so that's what I was doing. I was actually in the process of applying to different medical schools. I got precision nutrition online nutrition certifications. I was a personal fitness trainer at the time, and my wife stumbled upon naturopathic medicine, and essentially I would say about 2 to 3 months, just kind of poked me every once in a while and said, hey, look at this, take a look at this. They are teaching everything that you're trying to do yourself. So instead of going to piecemeal my own education, they were offering that all in one degree. A big chunk of naturopathic medicine is nutrition. We do learn physical medicine in depth. And so I got that built into my foundations, and I thought that it was perfect. It made so much sense, not only with my future career, but with my own personality. It really vibed with what I believe to be the most important movers of your health, right? Movement of the obstacles to cure, right? It was a big piece of getting true healing and trying to work with the body instead of against the body. As a naturopath, you're trained as a primary care physician, kind of jack of all trades. And I really do like that. But at the end of the day, you end up nudging yourself, and your patients nudge you towards the things that you're really quite good at. And the things that you gravitate towards tend to be things that you have some competence in. And so I have really adopted the regenerative medicine, the chronic pain patients, sports medicine injuries, and that kind of stuff, because I'm familiar personally with those injuries. I'm familiar, I have a pretty long history of dealing within that space, and I'm very comfortable in that space. So I do love seeing my chronic pain patients and my acute pain patients. But at the same time, I really, really thrive and love my lifestyle diseases. So any disease that you can really make a big difference, either on preventing it from getting worse or even reversing it and improving overall health. So I'm thinking the metabolic diseases essentially. So obesity, diabetes, non-alcoholic fatty liver disease, chronic kidney disease, some of these really, really prevalent, very, very common disorders that us as naturopaths we have the tools to help with. And I think it's really one of the most empowering, not even empowering. I guess it's like when you have found the job that you need, or you're in the career that you need to be in. And those are the patients that are so rewarding because you can turn their life around, right? You can help them help themselves and give them tools to completely change their health span and their lifespan for, decades. I did my residency in regenerative medicine. I'm actually one of a handful of graduates in all of North America who has the background in regenerative medicine. So that includes the prolotherapy and perineural therapy and some of the therapies that we're going to talk about today. But yeah, I did a little bit over 1 year in regenerative medicine. Naturopathic medicine is a huge piece of the puzzle. I think that it's what's missing in a lot of people's healthcare and wellness care currently, in the sense that we're treating the entire person. We are respecting the body and what it's trying to do and working with the body instead of trying to work against the body. And I think that that's a big piece that we don't typically appreciate in Western culture, and it's certainly reflected in our medical system. And so with naturopathic medicine, you can give people the tools, the education, the support that they need to essentially help them help themselves, right? I think that's naturopathic's naturopathic medicine's sweet spot. It takes a little bit of work. It takes a little bit of effort. It's not always a quick fix, but it is treating the root cause. It's treating the deeper systemic cause of whatever you're showing as disease, right? Whatever dis-ease you're presenting with is usually a manifestation of something a little bit deeper. And that's our role, right? Is to try to dig in with you, which is really, it's an interplay. You and the patients, you know your body better than anybody else in the world, right? And so my job is to help you express what you already know about your body, work together with my knowledge and your knowledge, and try to figure out a way that we can get you back to not just absence of disease, but actual health and wellness, right? I wish people knew that we work very closely and very well with other practitioners. When you come to see us, it's not like you're abandoning your favorite chiropractor and your favorite medical doctor and your dentist and your optometrist. We are working with all of those practitioners, and we love to work with those people. Some of my favorite people in the world, a lot of my family members are allopathic medical doctors or dentists. And I think that it's unfortunate that people view us as if we are competing in some way, but realistically, we're just working to help you be as healthy as you possibly can. And in fact, you're going to get better results if you work with your favorite practitioners across the field, right? My favorite thing is I would say the teaching aspect, because you can tell when it clicks with your patients, and you can see it light up in their eyes, or a little bit of that makes a lot of sense. And you can give them a new perspective of their symptoms, their relationship with their health. And sometimes it's right there in front of you. And that's my favorite piece. What accomplishments are most proud of? I think that graduating from SENM, among top of my class, very proud of that. I typically do not, I guess I can kind of go back. I went through my entire clinical education and my naturopathic medical school education with the mindset that I was working towards helping my future patients. And it really wasn't a competitive environment. However, by focusing on my patients and focusing on my future, I really excelled in my academics. And that is really what pushed me to be competitive enough to get this coveted naturopathic regenerative medicine residency, which is one and only in North America. I had to not focus on academics in order to thrive at academics, in order to get to where I needed to go. And I'm really proud of not necessarily my grades or how I performed, but how I got to where I needed to go. And I think I probably didn't know that at the time, but looking back at it, I'm very proud of how I handled that whole approach. I really tried to approach my education pragmatically and with a little bit of common sense, instead of playing the rat race and trying to, it's just about getting through your assignments or playing the game that way. I think a smooth system that accepts individualized approach. So what I mean by that is the way medicine is typically run in North America is a standard of care approach, which essentially tries to put a patient in a box, and the box is labeled. And the disease typically has a standard of care flow, where you have treatment 1. If that doesn't work, you go to treatment 2. If that doesn't work, you go to treatment 3, and so on and so forth. And the referrals are really based on when treatment X fails, you go in towards this other care, right? You try something different. Whereas an individualized approach on a large scale would treat the patient for their individual makeup, their expression of symptoms that might be completely different than another person with the exact same disease. So just knowing that, you know that the treatments have to be different. So instead of going through the same algorithm to get from treatment 1 to treatment 2 to treatment 3 to treatment 4, which inevitably leads people down a long, lonely journey through the medical system that takes forever for them to get results, versus getting respect as an individual right off the bat and having an individualized approach right off the bat that might skip, 6 months. It might skip 5 different treatments. And it goes down the line to what makes the most sense for that patient right now in your office. Personally, my parents, certainly my father, has definitely been a huge influence on me. He always instilled not just a hard work ethic, but also being intelligent about where you're putting your effort and treating people with respect, in the sense that they're on a completely different journey than you, but they inhabit the same earth, right? They inhabit the same space, so you have to have respect for them. Professionally, I have had a lot of mentors. I think that I was the type of student that went through my clinical training with the idea that I was going to be mentored by a dozen people instead of, shadowing one person all day long every day. And that's what I did. I really tried to connect with every single one of my mentors and tease out every little ounce of additional information that I could get from them, and tease out their expertise and their past experience, which often ties with their expertise, and almost like feed off of them and allow them to feed off of me too. It was always a two-way street. But it's tough for me to say this is my mentor, because I literally had a dozen or more through my clinical training. And I still have them. I'm still very close with all of them. And I feel like I could call any one of them up right now and they wouldn't be surprised to hear from me. That's where all the healing happens. Yeah, you don't really know what's going on until you connect with somebody on a personal level. And sometimes that's not right away, to be honest. Some people are, and rightfully so, some people are a little bit more guarded, right? But the doctor-client relationship or the doctor-patient relationship is where that guard kind of falls, and they let that guard down. And eventually they trust you enough to talk about the things that are really the biggest obstacles to get them better. And that is where the magic happens. There is no way around it. You cannot substitute something else for that. Oh, I'm an endurance junkie. No, yeah, I do triathlons right now. So I shouldn't say right now because of the COVID pandemic, but I love to train for triathlons, any endurance sport, trail running. I used to be a personal fitness trainer, so I do have my fair share of time in the gym when those are open as well. And then I spend a lot of time, when obviously it's safe to do so, I spend a lot of time with my family. Camping, hanging out by the campfire, even if it's just in Fish Creek Park, something like that. Yeah, we just love to be outdoors, exercise, combination of the both. My favorite trip was to Austria, and so Germany, Austria, and Italy, which was partially for an Ironman race that I went to back in 2015, and a honeymoon with my wife. So that was just an unbelievable trip. Just my whole family came to Austria for the race, and then my wife and I split off and went to Italy. Thai food. Yeah, I think so. I like spicy, I like spicy food. I like pretty much I really like Indian food too. But Thai food's my number one. I'm going to go with that, stick with it. My favorite podcast right now is probably Rich Roll podcast. However, Andrew Huberman, who's a neuroscientist at Stanford, just launched a podcast that I'm very excited for. So that might be close number 2.